Hi, my name is Kelly, and I'm an HHD educator for DaVita. Over the next few minutes, I'm going to be demonstrating for you how to draw your monthly lab draws, including your cultures and water samples. You will receive a lab kit from your home program nurse during your monthly clinic visit. This kit will include all of the necessary labels and tubes you're likely to need for your next monthly lab draw, including blood and water samples. The overpack shipping boxes are the only items that will be sent directly to your home by DaVita Labs. It is mandatory that you and your care partner complete the IATA, or International Air Transport Association training program. This program will outline your responsibilities in the care, packaging, and shipping of your lab samples to the laboratory for processing. Overpack shipping boxes cannot be mailed to your home address until this certification has been completed. This certification must be renewed every 2 years as required by DaVita and federal guidelines. Monthly lab draws provide vital information to your care team in providing and planning your care. Label the tubes and do not cover the lot number or expiration date. Your home program teammates will always check the date of all specimen containers before giving them to you. However, this should be done at home before collection of any specimen, blood, or water. All tubes must be drawn in a specific order because different tubes have different additives coating them. If these tubes are drawn out of order, the specimen will be compromised and this will affect your results. Verify the information on the SNAPI label, including the patient name, draw date on the label to the actual date, and it's the correct tube. Then arrange the tubes to be drawn in the correct draw order. Let us take a look at the other supplies you will need to gather for drawing your lab. 2 Vacutainer lure adapters, 2 disposable Vacutainer holders, 1 10 ml syringe pre-filled with saline, PPE, which includes gloves, mask, and a gown, the Lab 2 holder, the timer, the cooler, and your centrifuge. If your care partner is not available, place the centrifuge within reach on a stable surface. Also include a small cooler with a cold pack in it to store your blood samples until you can place them in a fridge or packaging for shipping. Attach the sample lure adapter to the Vacutainer holder. Be careful not to touch the gray rubber end, as there is a needle underneath that could cause accidental needle sticks. Once cannulation has successfully been completed, securely tape your arterial needle. You are now ready to draw your lab specimen. All labs are to be drawn pre-dialysis from the arterial needle and before heparinization, except the green SST tube. This is known as the post tube. This tube is to be drawn last after completion of your prescribed dialysis time. If you have used saline during cannulation, you must gently push and pull to thoroughly mix the saline and blood before attaching the Vacutainer to the fistula needle tubing. All tubes have a vacuum to ensure that the tubes completely fill. The blood or fluid will continue to fill until the vacuum is exhausted, and it is safe to disconnect the tube from the Vacutainer. Follow the directions on the SNAPI label for processing. All tubes need to be inverted immediately, not shaken, and inverted gently 8 to 10 times. This step is absolutely necessary for every tube, every time for accurate results, and to prevent a recollection of your blood. Do not place your tubes on the top of the dialysis machine. The heat from the machine will compromise the sample. Lavender tubes need to be refrigerated immediately. The red SST tube should be placed in the lab rack upright to clot for at least 30 minutes. Do not place the tube rack next to the centrifuge, as it emits heat and will cause the blood to hemolyze. Never let the red SST sit longer than 45 minutes, as this will cause inaccurate results. Use your egg timer to ensure the accurate processing. Never spin the red SST with the green SST at the same time. Different volumes will result in a partially spun sample and a recollection. Once the specimen is clotted, it is time to place it in the centrifuge and set the timer for the right amount of time for the sample. Please refer to the label on the tube for the correct spin time. Once the centrifuge has completely stopped, immediately place the specimen in the refrigerator or cooler until you are ready to pack. IATA instructions must be followed when shipping specimens to the DaVita lab. Now it is time to draw your green SST tube, which is your final and only post-lab tube. This is the only tube that is good for 5 days. The only test that is run on this tube is the BUN, or blood urea nitrogen. The pre- and post-bun test is necessary to provide a URR and followed by a K2/V. The K2/V is a calculation for adequacy and a reflection of how well you are being dialyzed. Prepare your supplies. Avoid giving a saline bolus during the last 30 minutes of your treatment. The saline may affect your lab results. When you have reached the end of your treatment, your machine will read 000 in the volume and dialysate screens. Allow the blood pump to continue running and wait 3 minutes. Timing of the lab draw is very important. An early or late draw can result in an inaccurate lab result and may also result in a change in your dialysis prescription. Apply antibacterial hand rub to your hands and then put on a clean pair of gloves along with your mask. Place a clean barrier under the arterial tubing access line. After 3 minutes, press stop on your machine. Clamp the arterial needle and the red dialysis tubing clamp. Disconnect the blood lines by loosening the Luer lock around the fistula needle and gently twist apart. Attach the Luer adapter to the fistula needle and attach your dialysis tubing to the top spike at the saline bag. Avoid touching any of the open ends of tubing. Attach the fistula needle. Place the green top tube inside the vacutainer and allow the tube to fill with blood. Remove the tube and gently invert 8 to 10 times, then place in the tube rack. Clamp the fistula and remove the vacutainer. Attach the saline pre-filled syringe and flush the tubing and clamp. Press the Add Fluid button on your machine and return your blood. The green SST tube does not need to sit for 30 minutes to clot. Spin the tube for 15 minutes and place in the refrigerator until ready to pack for shipping. If you dialyze on a conventional machine, your home training nurse will instruct you on the correct procedure for drawing post-lab specimens. Our goal is to have labs collected accurately the first time to prevent recollection. The top 4 reasons for recollection are clotted lavender tubes, hemolysis, specimen placed in wrong tube, or unspun samples. All of these are preventable, so always follow the directions for collecting, spinning, and packaging of your lab samples. Always contact your HHD nurse when you draw your laboratory specimens. If your specimen has an incorrect draw date that varies from the date that is on the label, this will prevent your laboratory results from being received, and this will delay any changes in your treatment that your medical team may deem as necessary.
Hello, my name is Sharon, and I am an HHD educator at DaVita. In the next few minutes, I am going to demonstrate how to perform your water sample collections for AMI and your dialysate sample collections for culture and endotoxins when using the NxStage System 1 and PureFlow. Drawing these samples correctly is very important and help us to monitor if the water is safe for your dialysis treatment. First, I will show you how to collect your product water sample for AMY testings from the PureFlow pack. Collect your supplies: 150 milliliter red top cylinder tube, 60 milliliter syringe, 1 sterile recirculation connector, snappy label, and requisition. If batch is present, clamp the 2 blue clamps on both sides of the non-reopening clamp. If there is no batch present, there will only be 1 small blue clamp and the non-reopening clamp. Leaving the 2 blue clamps on the left side, pack side, disconnect the sac from the pack at the lower connection. Remember to keep the ends from becoming contaminated. Attach a 60 milliliter syringe with a recirculation connector to the pack water outlet line. Unclamp the small blue clamp and withdraw 60 milliliters of product water from the pack. Reclamp the small blue clamp. Open the sterile 50 milliliter red top sample container and place the lid of container facing up on a flat surface. Fill the container with the 50 milliliter of product water from the syringe. Replace the lid on the container. The sample container must be full or the specimen will be rejected by the lab. If there is a batch present, reconnect the sac to the PureFlow pack and unclamp the 2 blue clamps. Prepare the sample for transportation. This sample must be refrigerated, if not sent immediately. It must be received at the lab within 24 hours. If you are using a dialysis machine other than your NxStage System 1, you will collect this sample from any tap water site, such as your sink faucet. Now we are going to review the proper techniques for obtaining your dialysate samples for cultures and endotoxins from PureFlow water system. It is important to follow this procedure carefully so you do not contaminate the sample that is being tested. Gather your supplies: 1 clean disposable pad or barrier, non-sterile gloves, mask for everyone in the room, NxStage PureFlow dialysate sample bag, prepared dialysate in PureFlow sac, wash your hands, put on your mask and gloves, open the dialysate sample bag over wrap and place on the clean pad. Confirm that the display on the PureFlow module reads, L batch use, go. The liters displayed will depend on the SAC prescription. Press go and the display will read, config to use batch. The dialysate pump must be on in order to get your sample. Carefully remove the protective cap on the remaining dialysate port. Carefully remove the cap from the dialysate sample bag and connect the dialysate sample bag port to the dialysate outlet port. Unclamp the dialysate outlet port. Press go on the PureFlow. Allow the dialysate to flow into the empty dialysate sample bag until the bag is 2/3 full. Press stop on the PureFlow. Reclamp the dialysate outlet port line, green clamp, and dialysate sample bag line. Disconnect from each other and replace their respective caps.